When should parents, optometrists, and ophthalmologists be concerned that progressive myopia, as Dr. Young has described, is developing?
So just like Dr. Young mentioned, the definition of like high myopia essentially starts when the prescription is sitting at about -5 or -6 diopters. But another really important feature is if the prescription is just rapidly increasing. Let's say every well child visit, you realize this child's prescription has gone up by another zero point 0.5, or it's just rapidly increasing, regardless of the magnitude, but it's just rapidly increasing. Then that's that's sort of a red flag, and they have ways of trying to. That's when they start considering things like myopia management, just ways to try to slow down the progression of the eye so that long-term sequelae like macular degeneration, retinal detachment don't result in the long run. Yeah.
And can you define again what you would consider rapid increase? So it's not.
So typically when we talk, and this is usually where parents tend to, one of the access points to primary to healthcare is as part of a well child visit where vision screenings are supposed to happen from age 3. It's supposed to be annually. So outside of school screenings, which screenings can mean different things in terms of frequency depending on where you are in the country, at least well child visits, it's a standard, and this is a recommendation through the American Academy of Pediatrics, the American Academy of Pediatric Ophthalmology and Services. So a bunch of professional groups recommend that a vision screening should be part of a well child visit annually. So if you're going to these annual visits and each time we realize that the prescription has changed, although I must say that this is primary care screening. And for the most part, the type of screening that's done in primary care looks more at or report more of the visual acuity of the eye as opposed to the refractive state of the eye or the power of the prescription that a child might be using. But regardless, the visual acuity, if the child's refractive error is increasing, very likely the visual acuity will also be getting worse, which your primary care physician would then request for referrals to see an eye doctor. So at the eye doctor is where you're going. Eye doctor, I mean optometrist and ophthalmologist. That's where they will actually be able to test for the exact refractive state of the eye, and that's where they'll be able to determine that the power of the eye has increased since your last visit, be it a year ago. And usually with that, the eye doctors will then ask you to come in more frequently, perhaps every 6 months, just to keep an eye on that refractive error, or that refractive state or power of the eyes.